Okay, we are good to go. Hi, everybody, and welcome today to our panel. So, Partnering for Big Impact Advancing Health Research in the North. I'm going to briefly share my screen here now. Thank you so much for joining us and bearing with us as we navigated a few tech issues. So hopefully you've had a fantastic time at the conference so far, and what a stellar lineup we've had of workshops and presentations. So here we are coming towards the end of today, and this panel will really help us understand some of the amazing partnership opportunities and activities that are really spearheading the North in terms of advancing health outcomes of our populations, but also advancing health and science in the broader picture, not only in BC, but in Canada and across the world. I'd also like to acknowledge today I'm here on beautiful Slightly territory. I think what a windy but stunning day. And just gratefully acknowledging that many of you may be from other territories across BC and beyond. And so we're super grateful to be guests and uninvited visitors on the many unceded traditional and ancestral lands of many Indigenous peoples and communities whose ancestors have inhabited these lands for countless generations. And so really wanted to say how grateful we are. So we brought this panel together because, you know, that we're not alone in the North. We may be small, but we work together in really instrumental ways to bring about change. And I think what we have that's really unique is a focus on partnerships, in particular around advancing health of our communities. And so just as our context, here in the North, we know we have a very dispersed population over large geography and with very varied climates and environmental contexts. And with that, we know that these sparsely populated areas can also contribute some challenges in how we deliver health services and how people and communities can navigate and use those. And so we also have many health disparities that affect northern populations, and we do have some of the poorer health outcomes when we compare to our urban counterparts. But despite that, we have fantastic, resilient and connected communities. And it's through that we're also able to mobilize agile partnerships and engage in really diverse research that brings around meaningful change. And today I'm so delighted to be moderating this session and have some really esteemed panelist guests that are going to talk about some of those initiatives. Now, what's interesting, we're going to have a couple of different levels to explore through this panel presentation, and I think it's what's going to make it super interesting. We have a team here that are going to look at the Memorandum of Understanding, and that is the overarching agreement that connects entities such as Northern Health, UNBC, and other partners together to work together to tackle health. And we also have a panelist here that will be speaking around the Northern Centre for Clinical Research. And this is a really innovative centre that's driving advancement in science, in health, in technology, through clinical trials and clinical research to advance the health of our populations, but also reduce inequities in access to these often life-saving and life-changing treatments. And so really exciting a centre to talk about with some great initiatives. And then we also have an initiative that we're looking into the future of, and this is the Northern Hub for Health Research as part of a HRI initiative and a joint initiative of bringing together so many partners. And this is a truly exciting way that we're looking to the future to really bring about change and impact and really build a global audience for our work. And so without further ado, I'm going to start by asking our panelists here to introduce themselves. So let's say hello to our panelists. I'm going to go down on my list. I'm going to ask Julia, then Anurag, Sarah to start.
Great. Sure. Thank you, Davina. My name is Julia Bickford. I work at Northern Health here on beautiful Clayton territory as well, here with Davina. And my role is the Executive Director for Research, Innovation, and Evaluation.
Great. I can go next. Thank you, Davina. Hi, everyone. My name is Anurag Singh. I'm a settler on the traditional unceded territory of Clayton. I work in Northern Health Region as an internist nephrologist. I've been here for about 12 years and also have a role with the university, assistant professor with the Department of Medicine at UBC and also with the Division of Medical Sciences at UNBC. And I'm here today to speak on the perspective from Northern Center for Clinical Research, and I have a role as a director there. Thank you for the invitation and great to be here.
Hi, everyone. My name is Sarah Gray, and I've lived on Clayton territory for about 17 years now. I'm a faculty member with the Northern Medical Program and Division of Medical Sciences at UNBC. Currently, I'm very fortunate to be the co-lead of the Health Research Institute at UNBC and the research lead for the Division of Medical Sciences at UNBC.
That's great. And then we're also going to have our introductions from Nazrin and Tatiana.
Absolutely. Thank you so much, Davina. So my name is Nasrin Golzadeh. I'm the project manager supporting the partnership between the University of British Columbia and Northern Health. I help coordinate initiatives under the MOU across different teams, and I'm joining from the Mohawk, the territorial Mohawk community. Thank you.
Hi everyone, I'm Tatiana Barcelos Pontes. I'm the Regional Research Manager for the Northern Center for Clinical Research. That's the research arm from Northern Health. And I'm also joining from the ancestral territory of Clayton.
Fantastic. And I'm Davina. I'll be your moderator today. I'm currently the interim Associate Vice President Research, Professor and Scientist here at UNBC. And what a great lineup we have. So let's begin and get stuck into our panel. And now we do have today 3 guiding questions that we're going to ask our panelists to respond to. But as audience members, I'll also be moderating the chat. So if you do have questions, please do jump in there. Okay, so we will start. So really, I wanted to start by exploring these fantastic initiatives and partnerships. But how did they start? So let's go back to our background and context. So our first question really is about how these partnerships came about and what were some of those key features of that historical creation and that motivation. And so I think we'll start with our MOU partners. And I believe, Naz, you're going to be up to start.
That is correct. Thank you so much, Davina. So before I jump in, I just wanted to say, as Davina mentioned, this is a discussion session. I want it to be interactive. So my colleagues, I invite you and other panelists, please jump in if you have any additional context to my answers. So to just answer the first question, so honestly, when I think about the collaboration between the University of British Columbia and Northern Health, that goes back to 2010. The agreement was first signed in 2010 and it's been renewed several times. Something that stands up and it speaks about the strength and the relationship building that's been built over the past 15 years. So this is a very a strong component of this agreement, I would say, the relationship. So, and this relationship is actually grounded in shared learning and mutual respect, and most importantly, what is important for the people of the North, what the people of the North and the communities in the North really need. And at its core, the MOU is actually here to improve health and well-being of the Northern people. I think this is really strong and it's really important and powerful to just bringing both sets of both organizations sets of skills such as educations and research and healthcare communities and professionals to actually learn from one another, to see what the problems are in the North and try to come up with ideas and solutions. So what really drives the partnership is the commitment to culture, safe, and community-driven collaboration. So there's always room to improve. By all means, I'm not saying like we are perfect, but we are still learning. We're thinking ahead, and to me, it's all about listening and learning and moving forward and adjusting as we need. So so that we could come together and work together as a big team and find ways to actually make changes, make big lasting changes for the people of the North. Thank you.
That's great. Thank you so much. And so that's great. That really sets the scene for the relationship. And now I think we're going to ask the same question, and again focusing more on our newly developed Northern Centre for Clinical Research. And I'll hand over to Julia. Maybe you could tell us about that development and that motivation there for this partnership.
Wonderful. Thanks so much, Davina. So absolutely, I'm just so pleased to be able to share this experience. And I just want to maybe situate this within my own experience. So I'm going to be answering this question from my perspective, as we all only can do. So I joined in 2020, and there was a lot of work to establish the NCCR even before that. But I'm going to be kind of talking about my experience from when I joined. So the NCCR, for those who don't know, is a tripartite partnership between Northern Health, UBC, and UNBC. And it formally opened in March 1st, 2022. But like I said, there was years of work leading up to that. Lots of people who were involved going back probably a decade, recognizing the need for this. So there had been this long-standing recognition that we needed to do more within Northern Health, specifically to support clinical research and researchers. So researchers in the North were often unable to get samples shipped or access our lab or pharmacy supports, and there were no real clear processes or standard operating procedures, no policies to guide us in Northern Health in kind of navigating those clinical research demands. It just wasn't part of our culture here. And so when I first started my position in 2020, as the director for research, it was really clearly communicated that this was going to be a major priority and that we really needed to figure out how we could better support researchers in our community. So we started an informal clinical research advisory group, and when many of the panelists on this call and others probably in the audience were part of that group, and it really made clear some of the frustrations that researchers had, and then also the frustrations that Northern Health Operations had, because they felt like the researchers were unaware of the kind of competing demands or the lack of resources, infrastructure to support their research requests. So there was this kind of tug of war happening. And I guess just you have to understand that big centers like BC Cancer or VCHRI, they're huge machines that are supporting everything from contracts and agreements to SOPs, research finance, and all of this stuff still needed to be set up here. It just felt like everything that came up to us, any study, we were always starting again from scratch. And luckily, right around this time during COVID, Michael Smith Health Research BC gave us some really needed financial support, which allowed us to hire our first clinical research coordinator and then a manager within Northern Health. And that was just a huge kickstart. But it also became obvious that there was other needs outside of Northern Health. There were challenges related to faculty development, to training for clinicians who maybe wanted to develop research as a component of their career. And people just didn't really know where to go for what. Obviously, we had the HRI in place, which was doing like a really great job helping support people who were health system researchers. But I think it's fair to say that people who were doing more clinical biomedical research still felt like they needed more support. So yeah, from the beginning, it was just really important that we situate this clinical research in the unique needs and realities of the North, working with rural and Indigenous communities, advancing more equitable access, like you said, Davina, to clinical trials, for example. So through a lot of dialogue, we decided that, it's probably better if we work together more formally across our organizations and develop this center to help people navigate where they could be best supported. And so the NCCR doesn't duplicate work that's happening within these three organizations, but it acts as a front door, like a much needed front door for investigators, sponsors, clinicians, just to help put them in the right direction of where do they go in our ecosystem to get support. So it's really built on this realization that we're too small to duplicate work across organizations. We need to be more effective and efficient. And we can do that by having this center that kind of sits in the middle of these three organizations and helps to shepherd people and really coordinate the efforts between the organizations in a good way. So from my perspective, that's kind of what some of the motivating factors were.
Yeah, no, that's great. And I think our next panelist, Sarah, talking now about the future Northern Hub for Health Research. Yeah, take it away. Tell us more.
Thanks, Davina. Yeah, so the Northern Hub for Health Research is sort of more of a single project. And so that's why we sort of purposely ordered them in this way. And it really is a big transformative project. Some have said audacious, and I would maybe agree, to create a Northern Hub for Health Research. And this has really arisen out of a common need to advance research outside of urban centers. And from our perspective here in Northern BC. And from the earliest conversations, like really early conversations, this has included four key partners, UNBC and Northern Health, the Lheidli First Nation, and the UBC Faculty of Medicine. And I'm going to mention other partners a little bit further down, but those really are the key four partners that have been involved in this specific project. And in the words of one of our leads from the Lheidli First Nation, she actually calls it the About Time Project, because it is about time that we have an investment in health research infrastructure in our region, in the province. And so the motivation for this really is to advance health research to support health equity for Northern, rural, and Indigenous peoples. And discussions for this project started in about fall of 2023. And it was fueled by a federal funding call specifically for health research. And I mentioned that the project exists without that funding call, but it really catalyzed, I think, the partners coming together and really moving forward for this deadline. So what exactly is the project? The project is, the goal of the project is to create an Indigenous informed multidisciplinary health research spaces to change how, where, and who does health research in Canada and who benefits from it. And so we're talking about the creation of a standalone health research building on the Prince George UNBC campus that would actually be the first standalone research building in Northern BC. We think actually north of Kamloops, and then a clinical research unit at the University Hospital of Northern BC that would be connected. And Julia actually used the word front door. That certainly has been a goal for the Health Research Institute and the NCCR. And this project really is about building that front door. So the actual front door that you can knock on. And, you know, that's so important just to signal that health research is going on. Like clearly after today, health research is going on in the North. But I don't think it's particularly accessible or well known because we don't have these physical structures that support that engagement with community health professionals and researchers. Yeah. So I just wanted to finish by just saying that I did mention the four key partners, and I'm welcome to answer questions about it, but we have actually many other people that have expressed interest about being included in this project, well over 20 from across the region, including organizations like Carriacou County Family Services or the Wilkes Willopsol Niska Institute, provincial bodies such as Michael Smith Health Research BC, BC CDC, First Nations Health Authority, and even national organizations such as the Public Health Agency of Canada, and that's just to name a few. So we really have tried to engage, and our vision for this project, while it's starting on the territory of the Lheidli here in Prince George, will be for it to expand across the whole northern region.
That's fantastic. What a great start to hearing about some of the partnerships. We'll now move on to talk a little bit about some of the uniqueness and innovation. And so let's start by thinking about what's unique about how this partnership has developed, and thinking a bit more about some of those innovations or success factors that are helping to meet these initial intentions. So again, I think we'll start briefly, I think, over to you, Nazrin, for the MOU. I think we could keep it a little shorter. But I think I'd really like to hear from Anurag then, and then Sarah about, I think, really honing in on some of the innovation to take place here. So thank you, Nazrin, over to you.
Absolutely. Thank you so much, Davina. And Julia and Sarah, I think that's such a beautiful space for me to continue with the question. And I'm answering more in the general terms. So thank you so much for adding more context and details to it. So to answer the second question, if I want to talk about the processes and characterization of the MOU we have, there are 5 core priorities under the MOU. One is training in health, human resources, research, culture, safety, co-fundraising, marketing, and communications. And we allocate funds every year under this umbrella and these priorities. And there's also an executive oversight committee that from both organizations that we meet with annually to review the progress, see the challenges, and think about the challenges, and also discuss new opportunities and identify new opportunities. There are several impactful projects that have been done or underway under the MOU. And they're all wonderful. I just picked one as an example to just mention here. One that is co-developed by the University of British Columbia and Northern Health to actually help attract and retain health professionals in the rural and northern community. And that's a really important initiative because of the healthcare system issue that we have in Canada in general, and more particularly in the northern context. So what this co-developed program is trying to do is actually to develop a program to use to actually bring in people to the healthcare system in a streamlined way. So this program is developed, or is going to be developed actually to help people to get the certificates and required education that is required by the healthcare system in Canada and in Northern BC. Whereas like before, there are so many healthcare professionals that are already in Northern BC, but they don't have that required certificates because they're coming from different countries. And this is an issue that the 2 teams from both organizations saw, and they're trying to solve that. And it's a huge task to bring in all this information and trying to build and develop a program to streamline this process. Let's say if people had to wait like 2 to 3 years to go through a program to get the required education and the certificate to start entering the healthcare system, this program is actually planning to streamline the whole thing down to a couple of months, which is really impressive. And if I want to, focus on what makes this MOU unique, again, I will come down to the partnership. The partnership that actually is open to listening, open to learning, open to feedback, and open to adjusting and moving forward as we go. And I think like this is an important initiative for us involved in this, to keep in mind that we are here for the people of the North and what they need. Sorry, I believe I went over 3 minutes, and I apologize.
Yeah. No, that's fantastic. Anurag, over to you.
Thanks, Davina. Thank you, everyone. And thank you, Julia. I love your background picture, by the way. That's amazing. So what makes NCCR different, unique, and innovation? So sharing my perspective in my role as the director for the last 2-3 years, but even as a clinician trying to do research and set up research in the North for over a decade, I think NCCR is kind of unique in many ways because I'm part of the UBC kind of group, which meets every month, and we're part of one of 24 research centers that is supported under UBC. So I see we're very unique. I see we're unique by spirit, by our intentions, and by our design, which is amazing. I feel we're truly Northern, like a model of research, and the one that is really situated in where we are, driven by partnerships for sure, and very equity focused, which I think is amazing. I mean, partnerships, being in the North, being a practitioner here, I felt like you relied on the health system down south to get the care people needed. So we've learned partnerships, we've learned collaborations, but we're now in a situation where we can lead through partnerships. We've learned through a lot of our experience that has happened with, Northern Health partnering with other organizations, and what we're doing right now, I think is very unique. I think the co-leadership model that I have with Julia, for instance, in Northern Health, it blending the operations of research, particularly clinical trials, and an engagement with the faculty and the researchers and the clinicians is very unique. So, the co-leadership model, it's itself like, Northern Health Part leads research operations and clinical trial readiness, and the NCCR is more about engaging researchers, clinicians, community, and providing that design and mentorship support, which I think is incredible. And really the other two pieces, which you don't see very often, is that equity piece, the cultural safety piece, the Indigenous partnership piece, which are very much the core principles of what NCCR is. And of course, really the health system change with learning health system approach, continuously learning through engagement, and really like the kind of motto in my head is we help clinicians do research and researchers connect with care, which is very important, which was the gap we identified. So clinical trial capacity building, the way we're doing it is absolutely unique. So I think the model of partnership we have is unique because it balances the operational strength with academic engagement and rigorous, very much rooted in the community. So I'll just stop there. Thank you.
Lovely. Thank you. Sarah, over to you.
Yeah, I think this builds on both of the two that have come before. So this will be health research infrastructure placed outside of an urban center. And actually, most of the health research infrastructure that gets funded in Canada does go to large urban centers. And, when we think of those kinds of applications, or some of us that do research, I'm a biomedical scientist, so I think of like applying for a neuroimaging center or something like that. Well, that would make no sense to put something like that here in Prince George. So our proposal is not something that's focused on one silo. We saw a great talk today that showed some beautiful pictures of silos. And instead, the vision for these research spaces is truly multidisciplinary. So the proposal talked about the strengths that are already happening in Northern BC, which are community engaged health research, clinical research, or things that we want to grow, clinical research, and biomedical research. And the spaces that we're proposing will have these three integrated areas of health research. The spaces will be located next to one another. So, for example, we imagine a large circular gathering space that would be inviting to community members or Indigenous community members to come and participate in research. And just down the hall from that, on the other side of a glass wall, would be a biomedical research lab. So instead of it being hidden behind doors, visitors to our campus and to our spaces could see other research that's going on, which would promote questions or what's going on in there and some interaction. So we're really talking about a different kind of research space that capitalizes on our strengths in partnering and doing multidisciplinary work. And we really want the spaces to reflect that both on campus and at the hospital and across the region as we expand. And so I think that is incredibly innovative in the context of sort of research infrastructure proposals, even though I think for us Northerners, it feels pretty natural. So we're trying to sort of replicate spaces that will reflect the work that we're doing here. I hope that's sort of one piece of the uniqueness.
Fantastic, thank you. And we are flowing lovely into our final question, which is really starting to look forward. And I think you'll all agree, these partnerships, we've built this foundation, we've seen these opportunities, and now we're really looking into the real potential for impact here. So we're going to start off with looking at some examples of what is evolving in new ways because of the partnership, again, because of the planned activities, and what this means for the future. Now, just looking at the time, I'm going to ask our panelists perhaps more to focus on kind of future impact and directions, and perhaps just a couple of minutes each, just so that we can allow some conversation and questions from the audience. So this is a good cue for our audience members here. Start thinking about those questions and popping them in the chat box. And so I believe, Naz, we're over to you to start for 2 minutes.
Absolutely. Thank you. I'll try to be very quick. So in terms of the collaboration and the partnership, the partnership is not actually only focused on the UNBC and the Northern Health. I think this is, we are building the plan for extended partnerships across sectors and communities. So there's also a stronger focus on the knowledge mobilization side. So meaning that the research is not only done and, being behind the paywalls, but also being shared and applied in ways that are improving the health outcomes in the North. So as we think about the future, sustainability and relationship building are the core. And we want to continue strengthening leadership capacity in the North, especially within and with the Indigenous communities, and keep creating a space for community-driven priorities to lead the way. So that's our future plan. And also something very important that we are trying to focus on, we're trying to to shift the focus from sustainability being just linked to about funding to being about holding space for future relationships and strengthening relationships and trust and shared values.
Mm-hmm.
So I think we think this is really important. So we will try to hold on this relationship between the two organizations that has been built over the past 15 years, and keep thinking outside the box while we listen carefully to feedback, and find ways to basically innovate and create new partnerships and continue to grow and evolve in exciting ways.
That's great.
So thank you. I hope I didn't overdo it.
That's perfect. Thank you so much. Anurag, over to you.
Thank you, Davina. Thank you, Nazir. That was great. So
Thank you.
we've just completed the 3-year strategic plan for NCCR, and it's given us the way ahead of what to do. And in the plan between 2025 to 2028, which is over 3 years, our main focus is to really build capacity for doing clinical research with a focus on clinical trials. With governance, processes, data, trial capacity, and a lot of this work that Tatiana is leading and Julia is supervising. And of course, the other part that really links us to the communities is cultural safety and Indigenous frameworks within the work we do. That's really important for our broader impact of research, and really strengthening those collaborations with the communities and community organizations, supporting mentorship, training, workforce growth, recruiting more PIs, clinicians to do research, supporting them to do more research. And our hope is that by 2028 or the end of it, we are, as an NCCR, is part of a self-sustaining Northern research ecosystem. And yes, we will do clinical research, but we're part of the same ecosystem. That's our dream. And hoping that clinicians are, as investigators, have somewhere to go. We can support them to do research, and communities as partners can contribute to research. And it's part of everything that we do every day, not as a part of a different stream. So I'll just stop there.
I love it.
Yeah, thank you.
So it's so great. Sarah, over to you for final comments.
Yeah, so the impacts of this are really broad. And I just want to say that this, of course, so it is a really big transformative project because we do really feel like it is about time to have a large infrastructure investment in health research in the North. And for many of you who live here in the North, you know that's not unique. So we've had things like UNBC or BC Cancer or the Northern Medical Program and other health professions programs. And it really took that really large infrastructure investment and sort of financial investment to jump us forward. And then we know that that's had so many downstream effects. So we see this as another sort of jump forward. And so the impacts are really far reaching. So if we think about, just in the context of research, Northern rural and Indigenous communities should have access to research as part of their care. Other people in Canada have that access. We do not consistently here. There are pockets, and I'm going to use the example of BC Cancer. Again, Julia referred to this sort of being a large machine that kind of supports that. And please, I don't want to offend anyone when I say this, but I think elsewhere within our medical system in the Northern region, it's a little bit more variable depending on perhaps who your caregiver is or how their teams are connected. This should be across the board. Without having Northern rural and Indigenous peoples involved in research, it affects their own care, but it also affects the Canadian health research data that we get, because it is now not representative of all Canadians. And then we develop things like guidelines, et cetera, and try to apply it to Northern rural communities or other individuals who live in these regions, and it just doesn't apply. So from a research perspective, the impacts are really important and really have that big potential to contribute to health equity in a really long-term perspective.
Mm-hmm.
Locally, it will help us to develop and advance our highly skilled workforce, not only as researchers, but in the services that go along with it. The connection or strengthening that connection by having those physical spaces where researchers and community members and patients and healthcare providers can interact also really helps with our recruitment and retention. We all know that the tower, So Exciting, is coming. We're going to have a cardio unit here. How are we recruiting cardiologists here who do their training at large urban centers and are used to having research available to them, even if they themselves aren't conducting research studies? They're used to being able to connect their patients with research studies. They're used to being able to have those resources available to them. So this is also a long-term contribution to our health system efficiency in being able to help not just specialists, but primary care physicians, other healthcare providers that want to have research accessible to them or to participate as a researcher. I think I'll stop there, Davina, because I think it would be great to answer questions.
There we go. Yeah, just inviting some questions there from our audience. Probably only have time for perhaps one or two at this point, and we were a little delayed starting, but I think you'll all agree, what a fantastic momentum for our region to be in. I was writing some messages down as I was listening and just really hearing, we are unique. We have our own unique needs, our own unique contexts, and it's timely. Like we are, we're not well represented in many different research spheres. I think reflecting on many of the panelists too, research is care, and we are stronger together. And I think we have a lot to be proud of here in our region, and the future is clearly very bright. So I can see here we do have some great comments here. So I can see this is exciting news, curious how it will extend to the broader Northern communities. And maybe I'll start by directing that to Sarah, and then maybe Anurag, if you wanted to pick up too.
Thank you. This is a great question and something the team has really sort of wrestled with a little bit. So in this sort of domain of health research infrastructure, Prince George feels pretty remote. I think in terms of, for example, the funder that we went to for this work, I think it's going to be quite unique for them to get a large proposal like this from a smaller community in Canada. But we certainly don't want this to be, people have talked throughout the day of like sort of hub and spoke models, things like that. We don't actually see this necessarily as a hub and spoke model, but more of a network, the first node of a network. So we have decided to move ahead by putting for this first proposal for some of the infrastructure to be located on Lheidli territory. But we have tried, and we will continue to do engagement across the region to identify ways that we can connect into this infrastructure. So initially it may be remote connections, but we actually hope that we can build on existing research activities. For example, I'll maybe let Anurag speak to it, but in some of the Carriers County family service communities, at some of the UNBC campuses across the region. I mentioned the WWNI in the Niska Nation. We've been meeting with folks there to let them know they're very aware of this project, and we've started discussions about how that could engage some of their community. So it really feels like a start, but we would like this eventually to be a network. And if there's anyone out there that has ideas about how we can engage better, communicate better, get the word out on this, please just let us know and reach out. We do have a website for the Northern Hub for Health Research. You can just search Northern Hub for Health Research, and there's email contacts there, and you could reach out at any time, and we'd be very happy to hear suggestions or partners that we haven't thought about. Anurag?
Yeah, actually, I think we're going to jump to Julia quickly,
sorry.
if that's okay.
No, that's okay. And Anurag, jump in as well. I just had a specific example where I think we are extending to northern communities when we think about clinical research. So we have some great examples, partly in partnership with BC Cancer, where we're doing remote follow-up visits in Terrace, where people don't have to come all the way back to Prince George in order to do follow-up visits, which has been extremely helpful for them not to have to do that driving. We've got nurses in Northern Health who are doing sort of arm measurements as part of follow-up care as well, again, preventing people from having to drive back. So where we really are doing some really practical work, creating that capacity in some of the smaller communities to help patients out who want to be involved in clinical research. So it's not just centered in Prince George. We really are trying to, in terms of lab capacity and pharmacy, and how do we kind of build that up? So we're seeing some small pockets where we're able to support those research studies outside of Prince George.
That's great. And Anurag, maybe a 30-second final comment?
Yeah, so the clinical trial we're launching next week in Prince George, we're going to have people who are able to travel within an hour or so and get compensated for their travel time to participate in a clinical trials, which is the first ever in outside BC Cancer. It's easy kidney trial. So there are examples, and there is much work to be done, but the communities are being engaged in research. We're actively, that's our goal, to look at developing the infrastructure and supports locally. I'll just stop there. Thank you, Davina.
Fantastic. Yeah, and we had another question about hoping for patient involvement, and I think I can say overwhelmingly that that is a huge priority here, and lots of expertise around patient and community engagement. And I know it's very much at the heart of our work here in the North, and so that could be a topic for the next panel, the next time we meet. And so with that, I want to give a tremendous thanks to our panelists and the audience today. Thank you so much for joining us. So thrilled to be able to share some of these great initiatives. Again, that future is so bright for us here, and lots of innovation and impact. And at the heart of that is our partnerships, not only with our research and healthcare organizations, but with our communities. And with that, we're going to transition now into our closing event. And I'm thrilled to be co-presenting with Nicole Cross, who's here. Thank you so much for joining us, Nicole. And so maybe I'll hand over to you to begin our closing, if that's okay.
Thank you, Davina. I am wrestling with some northern rural realities myself right now with the wind and the blackouts and connectivity. So I'm hoping that the connection will stay stable enough to see me through. So just give me a flag if I start to lag. Okay. So as we come to a close of the 2025 Northern BC Research and Quality Conference, I have the pleasure of conveying our sincere thank you to everyone who has joined us today, our presenters, moderators, workshop facilitators, and all of you who participated so thoroughly and thoughtfully throughout the sessions. Yesterday, there was a fulsome day of workshops that fueled exciting discussions and learning on topics such as AI, quality improvement, patient-oriented research, gender-affirming care, and clinical trials. Today, we heard stories and research that highlight the strength, creativity, and collaboration that defines the North. From innovative approaches to improving healthcare delivery, to inspiring examples of community-led research, and in particular for me, an appreciation for the weaving in and the storytelling of different Indigenous partnerships and a collective effort to honor and draw strength from the Indigenous partnerships that we have in the North. We want to extend our gratitude to our lunch speaker, Dr. Brianne Wood from the Northern Ontario School of Medicine, for her engaging talk on equity, centered learning and health systems. Each session reminded us of what's possible when we work together across disciplines, organizations, and communities when we are clear which rock we are moving through the partnerships. Although we had together virtually this year, the spirit of connection is still very present. It looks like, there we go, I'm back. Your engagement through questions, chat, discussions, and reflections continue to shape the future of health research and quality improvement in Northern BC. Sessions like this remind us that there is power when we connect our voices. And perhaps we can look for more opportunities to develop relationships with other northern and rural communities across Canada to raise awareness and advocate for solutions that are rooted in the North. On behalf of the organizing committee, we want to thank you for your time, your energy, and commitment. And we look forward to continuing these conversations. I know this was only a sampler of the brilliance and innovation occurring across the North, but I'm leaving here inspired and looking forward to continuing these connections. We want to acknowledge in particular the commitment and support of Nikki Neff and Brie Loeffler. Sorry if I mispronounced your last name, but thank you. Our admin and support team at both Northern Health and UNBC, you have been instrumental in working out all the behind the scenes details that brought this conference together and probably helping to make sure that I made it on with all this connection problem. So thank you. And I personally want to acknowledge the dedication and passion of Julia Bickford in ensuring no matter the obstacles, we continue to learn and be inspired together by the ongoing quality and research efforts across the North. My final prompt, and you guys will appreciate this as researchers and quality champions, please fill out the evaluation. Please see the QR code in the feed loop, our next conference. So thank you so much.
Thank you so much, Nicole, for those lovely words. Just as some final announcements as we close up here, we do have some student winners for the UNBC Northern Health HRI student poster session, and that we have our winners are Patrick Gertz, Jenna Ria, and Callie Fast. Congratulations all, and from our conference, sorry Leanna, I may have to let you jump in there. Is that
Sure, thank you, Davina. So all of the students who applied to the conference to do a presentation, they were given the option of applying for a student prize. And so we have 3 winners from that. We have for best poster presentation, we have Kara Hagblom for her poster Exploring Strength-Based Strategies with Rural Parents. And then we have a tie for oral presentations for the students. We have student Sandra Harris for her presentation, Connection is Medicine, Wet'suwet'en Wellbeing Through Land-Based Embodiment Practices. And we have Jonathan Doyen for his oral presentation, Elevating Youth Voices to Promote Healthy Futures in the Nechako Watershed, Insights from Efforts to Address the Nexus of Climate Change, Community, and Health. And just for those students, I'll follow up next week with them.
That's fantastic. Congratulations all. And so, yeah, as we bring ourselves to a close today, again, building on that fantastic reflection that Nicole offered, what a tremendous few days of learning together, sharing together wisdom, and really just sharing that spirit and that commitment to advancing health and equity in our communities. I think throughout all of the discussions and the sessions that I've been part of, partnership really is the transformative ingredient. And I think it's something we do incredibly well here, whether we're clinicians or researchers, healthcare providers, community advocates. You know, so far these collective efforts are really bringing light to our rural and northern communities, and we're shining bright for the world to see. And so with that, I think just recognizing too these opportunities to share, to work together. We hope that these inspire you and encourage you to be part of this movement. There's space in research for everyone. Research is care, and we very much hope that these conversations spearhead and make you enthusiastic in your own settings and practices. So we just really invite that ongoing conversation, and thank you all so much for being part of what has been a tremendous few days. And so with that, we wish you farewell and thank you for another year. And thank you again to our closing panelists and speakers. Thank you. Yay. Goodbye, everyone. Have a lovely day.